Hello again, everybody. If you're just joining us from the waiting room, we're so glad you're here, and we'll get started in just about a minute or so. All right, good afternoon, everybody. If you're just joining us from the waiting room, welcome. My name is Charlie Francis. I'm a project manager with the Council State Government's Justice Center, and I am very pleased to welcome you to our first in our webinar series on creating housing opportunities for people with behavioral health needs leaving prison and jail in California. We're very excited to present this series. I think whether you work in the criminal justice system, the housing system, the behavioral health system, or any other affiliated system, one thing we can all agree on is that affordable, safe, stable housing is just absolutely fundamental for the people that we serve. And I think another thing that we can agree on is there's just not enough of it out there. So we're hoping that this series will really help folks at the community level be able to join forces and develop some strategies that can really move the needle in this important area. And so today's webinar is going to start with the fundamentals, building partnerships across all of these different systems. So we hope you leave today with an idea of some important strategies, some next steps, and some approaches that can really lay the foundation for creating more housing options in your community. Next slide, please. Yes, so we are very excited to have the support of the California Healthcare Foundation for this series. CHCF is focused on providing access to healthcare for Californians with low incomes, and having safe, stable housing is absolutely fundamental. Housing is in itself a form of healthcare. There are many studies that back that up, and having housing is a stable platform that can really allow you to engage in the treatment and other services that you need and help promote better outcomes recovery. So we want to thank CHCF for their support of this series. Next slide, please. And our key partner in this entire effort is the Council on Criminal Justice and Behavioral Health. We have been working together for a number of years now on this important issue, and we really appreciate CCJBH's deep partnership as we do this work. But before that, I'd like to say who we are. We're the Council of State Government's Justice Center. We're a national nonprofit organization, and we're kind of a hybrid. On the one hand, we're a membership association for all three branches of state government. And on the other hand, we're also a think tank. And we focus on providing policy and research expertise to really develop strategies that increase public safety, strengthen communities. Next slide, please. And then for today's agenda, we're going to tell you a little bit more about the series, give you a little bit of an overview. We're going to talk a little bit about the report that we put out with CCJBH earlier this year, reducing homelessness for people with behavioral health needs, leaving prisons and jails. Just give you a quick overview of what's in there, focusing on the key housing challenges that this population is facing in California, and some key action items for state and local leaders. This whole webinar series is really based on that report and implementing its recommendations. And there's a lot in there, so we just want to give you a little bit of flavor and context. And then we'll highlight the recommendations from that report that are focused on partnership building. give you a few housing fundamentals focused on the key outcomes that housing leads to for people in the criminal justice system, as well as some housing models that are important in this work. And then we'll kind of get to the meat of today, which is strategies for building partnerships with your local housing providers. And then we'll get to what's my favorite part. We have several partners with us from Fresno County that are going to share what their experience has been in joining forces across systems to be able to really meet the housing needs for this population. They'll kind of share how they got to where they are today, the challenges and opportunities they've encountered, and some lessons learned for other communities. Then we'll have a bit of time, we hope, for breakout discussion where you can dig into these questions a little bit more in depth and start thinking about strategies that you can take home to your community and prepare you for hopefully the rest of the webinars. Next slide, please. And so now, like I said, CCJBH has been a valued partner in this work for several years now. And I'd like to introduce Brenda Graylish, CCJBH's executive officer, just to say a few words and give some more context for our work together.
Thank you so much, Charlie, and welcome to all of our participants who have joined us today on this webinar. We're really excited to kick this series off with the Council on State Governments Justice Center and also, working with support from the California Healthcare Foundation. Really just want to express gratitude to everybody, to CHCF for seeing the value in this work and continuing to help us, or helping us to continue building out this effort that we've been engaging in with CSG for the last couple of years. I've been the executive officer for CCJBH for a little over a year now, and had been a council member for several years prior to that. And our previous executive officer, Stephanie Welch, who is now our Deputy Secretary of Behavioral Health at the California Health and Human Services Agency, really kicked this work off in about 2019 and early 2020, and had developed some fact sheets on homelessness for this experienced by this population, and then also on Housing First. And that rolled into some discussions with the Council on State Governments Justice Center that ended up evolving into the project that was supported by the Melville Charitable Trust that resulted in the report that Charlie just mentioned, reducing homelessness for people with behavioral health needs who are leaving jails and prisons. So, the recommendations from that report, are something that we launched over the summertime, and it was just a really exciting event. This last summer was a lot of fun, starting to really kickstart this work. I mean, we had that preliminary work that had happened with the exploration of the topic that's really rolling into some concrete efforts, and so it's a great opportunity, a great time to be able to do this. I know we've been all struggling through the pandemic and everything going on, but there have also been some great opportunities and some unexpected funding that's come our way that we're able to leverage to do a lot of this work. And so now is a really exciting time to think about how we can really build out this infrastructure to provide housing for our population, because as Charlie mentioned, it is foundational in order for the services that we provide to be effective. But it really requires a lot of it's a complex project, and it requires a lot of work across multiple systems. And so really excited to have Fresno County here today to talk about what they're doing and really showing us how that system partnership and those collaborations at the local level can really bring this to life and actually help provide these important housing services for our population so that we can optimize success and healing and strengthen our communities. So really excited to be here today, really excited to kick off this series that's going to go through April, and really thank you to our CSG Justice Center team members on all of this. We really enjoy the collaboration as well. And thank you all to our participants for joining today.
Thanks so much, Brenda. And thank you for your partnership and all you do to spearhead and elevate this work in California. So on to the next slide, please. So just a little preview of what to expect through the rest of this series. Like I said, today we're going to be really focused on cross-system partnership building. But then after that, we are going to go through what we see as the rest of the key steps that you need to take in your local area, your county, your city, to be able to ultimately move the needle on increasing housing opportunities. So that includes session 2, which is really being able to assess people's housing needs when they come into contact with the justice system and be able to refer them to the housing and services that really meet their needs. Session 3 will go more in depth into actually building those connections with the existing housing that's already out there. But then, as I said, as we all know, there's not enough housing in general. So the last 2 sessions are going to focus more on strategies for building partnerships to actually develop new housing, as well as to generate resources for rental assistance and supportive housing services. So if you stick with us through all the sessions, it's really going to follow a progression from kind of the most foundational partnership building and assessment to really helping grow the pie and increase the supply of housing. Next slide. And so just a little bit more context on our report, what's in there to really ground this series. On the next slide, you'll see a little picture of the cover and a link to where you can find more information. You can usually find it on our CSG Justice Center website. And the report itself contains a brief analysis of kind of some of the key housing challenges that people leaving prisons and jails are facing in California. And this is based on a number of interviews with key stakeholders throughout the state leaders, county and local leaders, researchers, and most importantly, people with lived experience. It also takes a deeper dive into some real granular data in terms of what housing and service needs looks like for the jail and prison populations in our state. And like I said, has some 10 areas of recommendations and detailed action items for state and county leaders. So actually, if you could skip 2 slides ahead, as I think I just talked about that. Oh, sorry, one back. And one real important point from the report, and that we're going to keep coming back to in this series, is that whether wherever you sit, whether it's within the housing system, the justice system, or the behavioral health system, we are all serving a lot of the same people. Even though we may be sometimes working in our silos, the reality is it's a lot of the same population. And the data really bears that out. In doing this work on the report, we looked at a number of sources, including data from CDCR, prison data, behavioral health data, local jail administrative data, some national comparisons. And we're really able to kind of get a picture of what the scope of the need is. And so and this is just focusing on jail because we're more locally focused today, but the prison numbers are similar. So up to 10% of people statewide in jail will likely need some sort of ongoing housing assistance, being able to connect with housing and afford rent and utilities, and a level of intensive mental health services, some sort of very, very assertive case management and connections with treatment. Another 8 to 16% will probably also need this level of ongoing housing assistance with maybe a somewhat less intensive level of services. But the bottom line is here, we've got about this 25% overlap between all of our systems. And that's really who we're going to be focusing on today and through the rest of the series. Next slide. Now, this next slide, I could do an entire day-long webinar about because housing challenges in California and in every state are many, but just a few top lines from our report. There are 5 key housing challenges. Silos between the housing, justice, and behavioral health systems. That's something we all know very well. There's often not established communication mechanisms between these systems, and it can make discharge planning really difficult. Being able to take somebody from the point of involvement with the justice system to be able to plan for their housing needs and actually connect them with the housing and services that are out there. It takes a lot of handoffs between a lot of different systems and a lot of coordination and resources that can be very difficult. Another barrier is a lack of data on housing needs. We know that they are vast. but it is difficult to quantify the scope. Even the data I just showed you is based on a relatively limited but representative sample. Really, particularly in jails, it's often difficult to be able to consistently assess people's housing needs when they come into the facility or when they're leaving, due to people being there for a relatively short amount of time, relatively limited staffing resources. So that can be a real challenge in terms of making the case for what the need is, as well as connecting people to the right type of housing and services, because there's different levels of housing and different levels of services for different needs, and that costs different amounts of money. Because they're limited, it's really important to be able to match people appropriately. The third barrier is just in the housing market itself. There's widespread, stigma in California and everywhere, really. Many landlords and housing providers are reluctant to rent to folks who have been involved with the justice system. And housing providers, such as public housing authorities, can often have policies that make things more difficult for the people that we serve, such as long look-back periods or excluding people from housing due to relatively minor offenses that may not relate to their suitability as a tenant or to safety issues. There are also some larger level regulatory barriers, the biggest of which is the HUD definition of homelessness. For a good reason, it focuses resources on people who are chronically homeless, people who have been homeless over a certain amount of time, or more than a certain number of times within a certain period. And there are definitely good reasons for that. But again, because the pie is limited, it makes it more difficult for people who have been incarcerated, particularly for a longer period of time. And then finally, we're going to keep coming back to this again and again. The biggest barrier is that there's not enough housing out there for any population. And so what happens, in general in California, there's only about 1 in 4 available affordable units for people who need them. And so this has the unfortunate effect of creating long waits and even competition among different vulnerable populations that we serve. Next slide, please. And so we have 10 recommendations in the report. And today we're just going to focus on a smaller subset of them that are related to building partnerships. So I'm going to briefly highlight what those are from our report, and I'll hand it over to my colleague, Thomas, who will go into more depth in terms of strategies. So on the next 2 slides, you will see that our 10 recommendations from the report, and we're going to focus today on recommendation 1, which is building collaboration, recommendation 4, which is connecting people to the housing that's already out there and really helping them not fall through the cracks between, justice system involvement and getting connected with housing and getting connected with services. And then on the next slide, you will see that another area that will be focused on is the role of supportive services to help connect people with housing. Different strategies, how you can prioritize people who've been involved with the justice system for housing locally, and a little bit on how you can equip your staff and people you work with to help meet people's needs. And so on the next slide, you'll see in our report, we have recommendations both for state and local leaders. Here, we're just going to focus on the local level recommendations. The ones that in the report that I want to key in on is that are most important are really having a practice of inviting people from the housing and homeless services sector to your other meetings, where there might be a criminal justice advisory board meeting, criminal justice coordinating council, or attending folks from the justice and behavioral health systems attending housing focused meetings, such as continuum of care board meetings, creating direct intake mechanisms right from the point of being incarcerated or under community supervision directly into what's called the local coordinated entry system, which is basically a system that operates in most communities where people are sort of prioritized and deemed eligible for different levels of federal housing assistance. Engaging peers is another important strategy to help provide case management and connect people to the right housing. And then on the next slide, you'll just see a couple more recommendations. In addition to connecting people with coordinated entry, it's important to build partnerships through local continuum of care to really help build buy-in for prioritizing this population for local housing resources. And we're going to go into more detail in a little bit on how you do that. And then finally, providing key targeted trainings on just a variety of topics that can help equip staff to build partnerships and connect people with housing. So all that is just some context in my report, what the key challenges are, some highlighted recommendations in case you're following along at home. And now I want to hand it over to my colleague, Thomas Coyne, to go more into detail on some housing fundamentals and then key strategies that you can implement in your community.
Thanks, Charlie. Appreciate you setting us up for the day, and yeah, and now launching into our housing fundamentals. Just to level set a bit before you launch into some strategies that Charlie has already touched on. So on the next slide, we know that without intervention, that this cycle, unfortunately, of involvement between the justice system and homelessness, we know that it's cyclical, that it goes from contact with law enforcement all the way back to reentry, and so it continues. And all in all, we also know that it ties back into the challenges that Charlie mentioned, that again, he could speak for at least a day on, but that really do include challenges for partners between data and around silos, folks not talking to each other, of stigma that we know exists both in community with just general communities as well as from providers and agencies. But we do know the off-ramp. So on the next slide. And we know that this is really having a continuum of housing options that are available for people to enable choice that is, so central to housing first. And really, this lets us really address the needs of a diverse range of people as they're maybe diverted from or maybe being released from incarceration. And, it starts with permanent housing, and with that permanent supportive housing that we know pairs rental assistance and high level of supports, such as assertive community treatment teams that Charlie mentioned. And we see that being just very effective for this population. And we know that permanent housing and the interventions to really stand up permanent housing, that they complement short-term and recovery-focused housing is really as part of this continuum of housing options to make sure that we can meet people where they're at and also meet people with like their treatment setting that they would prefer, or really to fill gaps when we're really lacking permanent housing. And so on the next slide, we also know that housing is just so foundational, as Charlie was mentioning, so foundational for charging or for achieving these just key both criminal justice outcomes and really outcomes that people who are experiencing homelessness want to see themselves. And we know this is the core philosophy of housing first, providing housing without preconditions such as sobriety and treatment engagement. We also know that these services then are assertive. They're not waiting around for a call, they're going out and meeting people in the community, and really getting people engaged. And research shows that this increases housing retention and engagement in treatment services and reduces recidivism, especially return to jail. And potentially also reduces public costs associated with ongoing homelessness. And so on the next slide, of course, these outcomes and addressing racial equity as well This cannot be achieved without building cross-system partnerships, including with key housing partners. And so on the next slide, partnerships don't just happen in a vacuum, as much as probably we all would love them to. There are partnership building strategies to make them really concrete and really make sure that our partnerships are reflecting our communities. This includes inviting each other to each other's tables, such as inviting housing folks to reentry councils, like Charlie mentioned earlier, making sure that you go and sit on the boards of continuums of care or public housing authorities, which both lends a voice both ways and also helps with funding applications. Now, it's definitely a two-way street for all of us. There's also identifying shared barriers like access to rental assistance. And also there are ways to develop ways of leveraging some of the historic funding that's coming down currently with emergency housing vouchers and pairing that maybe with our local funding, maybe through criminal justice agencies to really supplement those resources and really help prioritize this population. And really also to have folks with lived experience both involved in the process and even leading these planning processes, since they're the ones who know what kind of housing they prefer and what things really are impactful for them. So on the next slide, we do have existing housing infrastructure out there, and this includes the homeless response continuums of care, which now thankfully have a really historic amount of resources out there. Although I say that and also acknowledge that we still know that it's not enough to meet the total need, unfortunately, of everyone experiencing homelessness. I mentioned this a bit before, and as did Charlie, but this joint planning, this sitting at the table and helping them out with their notice of funding opportunities. They get bonus points for having criminal justice orgs at the table and working with them, and helps them leverage that with additional federal funding and resources. And as Charlie mentioned, also this delves into their coordinated entry process and how folks are really getting connected to services, and making sure that those processes allow for people who are diverted from jail or who are returning from short stints in jail, that they're able to access coordinated entry. And we'll also be doubling back on this probably many times throughout this series, but want to at least start to lay the groundwork here for this idea too. So on the next slide, also looking at the housing, the general housing partners, and we have local public housing authorities, which they do have discretion to prioritize people who are diverted from or leaving incarceration. And this includes with the high number of emergency housing vouchers that they have at their disposal currently through the American Rescue Plan. And one additional way, as folks are maybe thinking about next steps in okay, we've partnered and maybe we have a building now that we could leverage, but we don't really have ways to finance it. When looking at this, or even looking at acquiring new housing through a place like Home or through Project Roomkey or HomeKey, they can be a natural place to support this, to really subsidize rent and operating costs through project-based subsidies. And on the next slide, I think we've lost our slides momentarily. If we get them back, so the other another avenue for housing is owners of our landlords, which we don't always necessarily think of. And really, they're the key to getting housing without subsidies, and having places to rent for people with a housing voucher. As much as having a housing voucher is amazing, sometimes still people aren't able to find places to rent or places that rent to them for any number of reasons, including just scarcity, including stigma, all these things. Communities do find success in reaching out to landlords and recruiting them. That includes, hiring folks with real estate or business backgrounds who can speak the same language as landlords, and really then be able to bring back their concerns or really bring their voice to the table as you're building these partnerships and trying to open up additional housing. And this also goes to also other owners of private housing and land, private housing, including like apartment buildings or other multifamily property management companies, and land, including surplus or unused buildings. And really here, it's about finding common ground and really having a shared mission. Probably share the same mission as some religious organizations, perhaps, that are looking to serve this population. Some folks with surplus land or surplus buildings also might just be interested in guaranteed income from rental assistance, and be willing to serve this population. So there's just a lot of different ways to think about different buildings and things that might be underused, but might be ways to open up additional housing. And I see this as playing out in the chat as a lack of places to rent, and definitely a challenge, and definitely ways that we really have to kind of think through all the various ways that we could possibly open up new land or new buildings to rent. And on the next slide, ultimately, it's about working together through housing partner collaborations and making sure that we try to off-ramp people in this shared population that Charlie just illustrated so well, from this cycle, and instead achieve the key outcomes of stability that we want, that people who are experiencing homelessness, who are involved in this cycle want, but really just the ways that can help both hammer this home together and leverage these resources together for folks. So now I'll turn it over to Jolie Gordon Brown, Mitch Collins, and Melanie Johnson of the County of Fresno, and share about their collaborative work. Thanks, everyone.
Good afternoon. Thank you. I am really excited to see how many participants are in this. I think, Charlie, we didn't think there'd be this many, and it's so exciting. And it tells me what a focus housing and the intersection of housing and the justice system really is for all of the people in our county trying to provide services. So hopefully we can give you some ideas today. Mitch and Melanie, would you like to introduce yourselves? And then I'll go ahead and introduce myself.
Yes, thank you, Jolie. My name is Mitch Collins. I am with Turning Point of Central California, a contracted provider through DBH. And I'm the program director over two programs that specifically works with the forensic population, one being the diversion program and the other being the AB 109 First Street Center Full Service Partnership Program.
Good morning, everyone. I'm Melanie Johnson with Fresno County. I'm the Assistant Deputy Chief Probation Officer, and I oversee the quality control, program evaluation, and training in our department.
Thank you. And I think we can move this slide forward. Excellent. And I'm Jolie Gordon Brower, and I am a division manager for adult services with the Fresno County Department of Behavioral Health. And as this is a presentation on collaboration with multi-systems, I just wanted to note that we have behavioral health, we have a contracted service provider, behavioral health service provider, and we have probation here today. So it can be done. Next slide. All right. So a little bit about Fresno, for some of you who may not know, we're the 5th largest city in California, with about a little over 500,000 people in the city of Fresno, but we have nearly 1 million in the county. So demographically, you can compare us to your county and see where we fit. We're large, but we're not so large as the state of Los Angeles. And we have our challenges. We are very urban in some areas, extremely rural in others. We sit on what I will call the corrections corridor, which is that little space of land that runs the Interstate 5 and 99 that has, I think, probably the lion's share of state prisons, sort of nestled in that valley in Central California. We also have a very large county jail, which is fairly old, and we are extremely proud to say that next year, mid-year, we'll be moving into a brand new state-of-the-art jail. And we also have one state hospital in Coalinga that's in our county itself. So we are really proud to highlight the partnerships we have developed with our justice colleagues. We are currently really working hard to create alternate service lines that are kind of out of the box and creative to meet the needs of those individuals that we serve who have behavioral health and substance use needs. Our relationships are developed and focused on multi-agency collaborations, which includes not just our law enforcement partners, but also local hospitals, both acute hospitals and our EMS agencies, our psychiatric hospitals, and all of our other service providers, as well as our board of supervisors and our local politicians and our Better Business bureaus. So we really work in collaboration with all of these agencies. And I think both Mitch in Turning Point and I know the County of Fresno Department of Behavioral Health are all partner agencies in our continuum of care. So we are full circle there. Next slide, please. Great. Okay. So about 2 years ago, the Department of Behavioral Health realized that we were going to be needing to really focus our attention on 2 specific areas, and those 2 areas were housing and forensics. And so we did a slight remodel to a couple of our programs, and with the intention of creating really subject matter expert teams that combined our contracts division and our clinical divisions into one, so that we would have full support in both our contracts and in our clinical teams to make sure that whether it's an internally operated program or a contracted operated program, we would ensure that our mission, visions, and values and our guiding principles in regards to the treatment that we provide for the people we serve was uniform across all services. And ironically, as I said, forensics has been like our busiest, fastest growing, most in need service line. So we've created quite a hybrid approach. And currently within our division, our forensics division, we are working on both adult and youth collaborative treatment courts. There's a number of those. Our AB 1810 diversion, which often will be called like our DISH diversion, Department of State Hospital diversion, grant funded program, and then mental health diversion courts. We have both a rural and a metro crisis intervention team, which are co-response teams with local law enforcement. And we have our clinicians, county operated clinicians, embedded into our jail services to work alongside the service provider, the contracted service provider in the jail, which for us in Fresno County is WellPath, for both our children's and adults. We have AB 109, mental health and substance use programming. We have recently launched a pilot parole coordination program after the discontinuation by the state of their ISMIP program. And then on the horizon, we have received a grant for jail mat services. I think all of us are probably working right now on developing some processes for January 1, when SB 317 goes into effect. We waived into AOT, and we are working with the state on CDCR data sharing project. We are not one of the first implementers. I think there's 11 or 12 counties that have already done that. For purposes of this, our AB 1810 DISH program was a challenge for us to implement. There were funding restrictions and diagnostic restrictions that didn't allow us to serve everyone that we would want to serve, right? DISH was restricted to 3 diagnoses, and there were other restrictions attached to that as well. But what we did do is we engaged the services of Turning Point, and Mitch will talk about that, to develop an ACT level service program for our DISH person served. And that was extremely successful, having ACT for individuals coming out of incarceration with substance use disorders. But we also wanted to provide similar services to folks who did not meet that DISH criteria. And we had some funding challenges with that. A lot of our services were subsidized they were subsidized by Mental Health Service Act dollars. And those dollars rapidly dwindled, especially considering the issues that we had with the pandemic. That is not a secure service line. So we had to come up with an alternative in order to continue providing services to individuals that were meeting mental health diversion criteria. And it was serendipitous for us that our AB 1810 diversion program was operated by Turning Point, and our AB 109 programming was operated by Turning Point. And so I am going to hand the excitement over to Mitch Collins now.
Thank you, Jolie.
Uh-huh.
Yeah. Very serendipitous indeed. Having both of those contracts has allowed us to really stack kind of some of the resources that we utilize to serve the people that we're trying to support. So I'd like to move over to the next slide and talk a little bit about the housing, as that's what we're here for. So as stated, it's really vital to connect people leaving the prison and jails with who are experiencing behavioral health needs to housing. And so what we've done is we've brought on the Turning Point Belgravia Center program to help house people rapidly. And so we can house people at Belgravia for up to 4 to 6 months. And this is for people that can or are coming straight out of the jail and prison setting. So Belgravia Center acts really as a off-ramp, on-ramp for those who are coming out of incarceration to the community, and really provides us as the treatment provider the time so that we can leverage wraparound services to increase the chances and the likelihood of someone being successful upon reentry. Turning Point and the Department of Behavioral Health has worked really diligently with probation to implement a step-up system to help individuals acquire resources and receive behavioral health services to gradually build stability, independence, with the intention of preparing them to transition successfully. Next slide, please. So again, leveraging what we have available to us to really build incrementally over the course of those 4 to 6 months, is vital. And we have people coming straight from the jail setting that we're able to get into Belgravia, and we're seeing a lot of success there. As opposed to when we're working with individuals that may have already been in the community for some time, we're finding that it is much more difficult to get them engaged and linked to housing. So ironically, we find that it's easier to bring them straight from the jail, coordinating with probation, of course, to get everything done all in times one day. From the point of release in the morning, by that night, their head is in the bed at Belgravia and services have been initiated. So that is really, really important. And at any time that we can take advantage of that, we try to do that. Next slide, please. Okay, well, we have all right. So this is supposed to be a graphic that shows our phase system. So we have a 3-step phase system for people that are entering the Belgravia Center. So the first phase is really focused on enrollment and participation in their behavioral health services. We want to develop an individualized service plan with those individuals, with their voice, of course, included in that. We're doing a behavioral health assessment. We're doing an assessment to gauge what their criminogenic needs are and prioritizing those top needs and meeting them. We're also applying for Medi-Cal, and we're identifying some transportation options for them because it's, again, the goal is to slowly and incrementally increase independence. Then we move into the phase 2 of the step, and that phase is really focused on encouraging consistent engagement in their treatment. We're beginning to apply for more benefits. We're developing transportation independence by really encouraging them to use public transportation or independent forms of transportation that they may have access to at least 50% of the time for their appointments and treatment, or for going out in the community and purchasing things that they need. So we're really trying to encourage, again, more independence. And then we move into the last phase, or the last step, which is 3, and that's, again, focused on independence. But by this time, we're starting to provide them with social passes out of Belgravia, where there's supervised staff. So these social passes are intended for the individual to really begin testing visits in the community on their own, where they have a lot of wraparound services from their provider, but we're wanting to expose them to managing the challenge of being in the community slowly, and building upon that as they get more confidence and build those skills. We're also focused on getting them all the benefits they'll need to transition into living in the community. So now we're focused on financial resources, either through GR, general relief, food stamps, right? Everything that they would need to really be prepared to make that transition. So let's move to another slide where hopefully we have, okay, we at least have some bullet points in this one. So now we're going to talk about the transition, and these are our housing resources that we've cultivated to fit the client to the best housing option available. So we have triage shelters. So the triage shelters are intended to be available for those who we need to remove as many barriers as possible. There's no specific requirements in regard to their income, sobriety, or behavioral health compliance in order to get in. But there are services that are wrapped into that to really encourage future independence. And we're hoping that they can move into another option that's listed here. So of course we have transitional housing. So this is similar to Belgravia that I talked about. And then what we utilize a lot is unlicensed supervised shared living homes within the community. Fortunately, Turning Point has been in the community for a very long time, and we've been able to build a lot of housing through various vendors, and that is really heavily dependent on relationships. I can't stress that enough. It is so important to meet with your vendors consistently, they're going to have struggles. Our population can be extremely needy and with a wide array of needs. And so the more that we can partner with those vendors, we find that their doors are open. And we're very honest with our vendors. We let them know, what our program is all about and the population we serve. So they tend to understand that. And it gives us at least some flexibility. So when struggles are coming up, they'll reach out to us and we can have housing meetings and discussions so that we can prevent an immediate loss of housing. Maybe we can buy some time to either transition them to another home or to maybe work it out if there's an issue with maybe some of the residents not getting along, which comes up quite often. I don't know about you, but I struggled with my roommates in college. So, our clients need that support too. Then we move into licensed board and care facilities. These facilities, are intended for a higher care. They have supervision, 24-hour care. This level can really provide additional supports for individuals that may struggle with health issues, in addition to their behavioral health needs as well. After that, we have independent low-income subsidized housing. So this is where you're going to see a lot of the help with HUD. HUD comes into play here, with rental support. And that's kind of really that line. And then we have family housing. Some of our clients are fortunate to have family members who are willing to bring them back into their homes. And oftentimes that's preferred. And so we'll definitely provide services and work with family members to educate them on behavioral health needs and bring them into the individual services as a support person. And then lastly, we have independent housing. And we really explore this option once someone has created the financial independence that is required of that, and has also built the stability to be able to manage their own lease or own their own home. So, and it does happen, and I'm very proud of anybody that's able to get to that level, and we have seen that success. Next slide, please. So leveraging services continue, right? So these are all the services that our programs offer to the individuals that we're serving. So the assessment, the treatment plan, medication evaluations, medication education, which is really important for our clients, and management. So checking in with them, ensuring that they have what they need, and providing pill boxes if that's required, everything that comes with that. That's a huge line and very important. We also offer individual, group, and family therapy, psychoeducation, rehabilitation groups, intensive case management, and crisis intervention. Next slide, please. So continuing to leverage our community resources, placement services. So all of those lines that I explained earlier all come with support with getting them in. So my team will go in and help the client establish whatever is needed for them to gain entry into those facilities. We also provide SUD programs, so linkages to outpatient services. As you know, many of our clients struggle with co-occurring disorders, and it's really important to link them to those outpatient treatments so that they could be working on that in tandem with their behavioral health needs and criminogenic needs. And then we also have inpatient residential facilities that we can refer and help them gain access to. Primary healthcare is super important. That's something that we try to get established right away, linking clients to a primary healthcare provider, and also healthcare case managers. We try to link them to those individuals if they have Medi-Cal with Blue Cross Blue Shield. They offer that service, so we link them to that as well. Health insurance acquisition, obviously super important. And then of course, vocational educational resources. We have programs that can help people get into jobs or into school with added supports. And lastly, financial benefits. Next slide, please. So Fresno County leverages a wide array of services, as you saw, and it's all intended to support individuals with getting and maintaining their housing in the community. However, there is a lot of competition for these resources, and therefore it's vitally important that we prioritize and target our population, which is why you see these 3 programs listed here with First Street Center, with Belgravia, and the diversion program. We're able to stack these resources between these 3 programs to really wrap around our clients and give them special access, right, to that immediate housing and then transitioning into housing in the community. Super important. Next slide, please. So I'd like to turn over to the Assistant Deputy Chief Probation Officer, Melanie Johnson, to discuss how we equip our teams to be successful with all these ventures.
Hi, good morning, and good afternoon, everyone. So in addition to what we have on the slide here, in court, we have mental health breakout sessions, which involve our judge, DA, public defender, and probation. Those occur regularly, and it's great to be able to sit down and everyone gets on the same page. We also have collaborative high-risk resource team meetings with multidisciplinary treatment teams and probation officers. I'll let Mitch talk a little bit more about that if there's any questions. But Fresno has a very unique existing partnership with all of our partners, and we were able to build on that. When CDCR identifies a client with housing needs and the individual is designated with SMI and the inability to safely transport themselves, we set up a treatment staffing prior to release so that we are able to immediately house that person at Belgravia Center. It's usually probation that does the transport or Turning Point, depending on the needs of the client. Our service providers are also on site at the probation office. Thus, a needs assessment is immediately conducted when the client reports. If housing is an identified need, we have the ability through Turning Point and Belgravia Center to immediately house that person, which is hugely beneficial. Our service providers are also given access to input into our case management system. Thus, our officers can access real-time information from the service providers, such as, did they miss a treatment session? Are things going well? Is there any additional assistance needed? Access to that information has been highly effective, and we found that very beneficial. Our service providers also have access to our risk assessments prior to a client arriving at their treatment. So we take a collaborative approach in addressing the case plan and meeting all the client's needs that way. Our treatment staffings occur bi-weekly with the provider and probation. That's a good opportunity where we have some face-to-face collaboration. And if there's any issues identified, they usually get addressed immediately. As a result of the treatment staffings, the client is able to see that there's a team on board to foster their success. The team reiterates that the client's success is the ultimate goal. So they see the client and they see the probation officer is on their side trying to advocate for their success. We also incentivize the clients to tell them, you know, if they get on the same page, they complete the case plan, we can terminate their supervision early. And that's highly effective because none of our clients really want to be on supervision. That's also a motivating factor to get them on the right course. Another opportunity that we have are in times of crisis, the assigned mental health clinician has the ability to respond to the client's location and coordinate with housing at Turning Point. So not only are they addressing their mental health needs, they're also able to immediately house the client if that's one of the issues. We have embedded our probation officers into our treatment provider facilities to foster positive working relationships and collaboration. So the clients can see their case manager at Turning Point, and they can also see their probation officer there. Due to COVID, we had to immediately equip all of our probation officers, with laptops and access to our case management systems remotely. So now we have the ability to go to any treatment provider and have access to the information they need. These are just some of the strategies that we've utilized to set our clients up for a pathway for success. And our partnerships have been key in doing so. So we're very fortunate as a county to have this collaboration. That concludes our presentation. I think the next slide is there any questions specifically for Jolie, Mitch, or myself?
Yeah, thank you, Jolie, Mitch, and Melanie. Really appreciate your time. So we've got a couple of questions that have come in through the chat. And if other folks want to throw them into the chat, we'll see how much we can get through, I think, in about the next 5 minutes before we move on to our breakout sessions. The first from chat is, does Fresno County still operate the co-response project where a behavioral health specialist would co-respond to sheriff calls about homelessness and behavioral health?
Yeah, we have a our crisis intervention teams. That may be what you're asking, our co-response model. We actually have for Fresno PD, which is our urban metro teams, our police officers are actually embedded. We are not embedded in the police officers building. They are embedded in ours, which is really exciting. We have a county operated small team that does post-crisis response. And then we have the co-response model with with a contracted program that can work longer hours than county operated folks can. In our rural communities, we have the same thing, but there's lots of different, you have to understand it's a big county, so there's multiple cities. So our rural response responds to multiple cities that are quite a big distance away from each other. So those teams have developed their own relationships with like Reedley and Sanger and Huron. Those are some of our smaller cities in our rural areas. And they do their crisis response out there with some post-crisis follow-up as well.
Great, thank you, Jolie. Appreciate that. The next question from chat is, can you explain what your crisis intervention teams are?
Sure. Our crisis intervention teams are a group of specialty trained officers for our metro team, which consists of 5 dedicated officers, a supervisor, and then the supervisor's supervisor, who are embedded into our Department of Behavioral Health building, our Health and Wellness Center, and a team of contracted clinicians who work with Kingsview to respond to mental health calls that come through the county dispatch system. So our clinicians and officers for our metro teams are dispatched to mental health crisis calls where they go out and work with individuals in the field to de-escalate, to make decisions about, 5150 placement perhaps, voluntary transfer to our crisis stabilization units, et cetera. And in our rural communities, it's the same, except that, as I said previously, the police officers, it's scattered communities. And so our crisis intervention teams get dispatched with whatever local agency the incident is occurring in. And they will meet there. It's just geographically difficult.
I think you've addressed 2 of the other questions in chat. So I think we'll go actually to the question that just came in about Do you have programs for long-term affordable housing or permanent supportive housing for the reentry population? Or is it perhaps short-term or interim?
So I can speak a little bit and then Mitch can speak on the Turning Point, because Turning Point is intricately involved in housing across our community. But as far as Department of Behavioral Health, we have, gosh, I'm gonna just quickly look behind me. You can't see this. I think we have 8 or 10 No Place Like Home, permanent supportive housing projects, affordable housing, permanent supportive housing developments in the queue right now all over Fresno County. We've just fully leased up one of our round 1 No Place Like Home developments. Our next round 1 development is coming this month. Should be fully leased up this month. And then previously we had some Mental Health Service Act collaboration with our Fresno Housing Authority for 3 separate properties. All of those provide permanent supportive housing to individuals with mental health or substance use disorder needs. So we have a lot.
In regards to Turning Point, we have had discussions with probation about the potential of building or expanding Belgravia to offer like a second phase where it would be much longer term. And of course, you know, with the pandemic, that kind of put things to a bit of a halt, but that is something that we've definitely discussed and, you know, have outlined as a goal for the future. Once we can kind of stabilize and look at financial resources in the community.
I also want to say that we provide a lot of support for our I guess landlords. We do have a contract with an agency that provides support to independent living associations. What we would, which most people would call room and boards, but we're trying to get out of that language, so we're calling them independent livings. And recently, well, in 2020, we recognized that with the pandemic, there were instances where the people we served may have not, and our service providers may have not really been fully aware of tenant rights and what it takes to evict someone, etc. So we engaged the ILA to do a series of educational webinars on tenant rights so that our service providers, our case managers out in the field, our clinicians could support persons served in their rights to remain housed. And as an offshoot of that, there were some requests from probation actually regarding the rights of the individuals who have 209s. And so we also provided that education. So there's a webinar out there for that.
And thank you so much, Jolie and Mitch, for that answer. And also Melanie, generally. It's really wonderful to hear about your collaboration and all the comprehensive work that you're undertaking to really bring to bear a continuum of housing options for folks in Fresno. It's really wonderful to see. So now I think we will move to our next session. So on the next slide, maybe even on the slide after that. Yeah, we will now split into breakout sessions where I think we'll probably have about 10 minutes to start discussing these questions. This will really serve as a jumping off point for the rest of this work and hopefully a starting off point for our webinar series as we go along. to really start moving these strategies that you've heard about moving things forward. And then we can come back and maybe report out in chat on what folks have discussed. And then we'll come back and just talk about some of our next steps and what's coming up next. So now I think we will split folks into breakout groups, and please feel free to start the questions amongst yourselves. I'll post the questions in chat right now before we split. There'll be a couple of us in breakout groups, but I think with the large response we've had today, we'll be in groups as we see.
Welcome back to everybody coming back from the breakout rooms. I know that was just long enough to be a tease. We could discuss these questions for many hours and many days, but just in the interest of time, in the chat, if you want to put just something that really struck you or found particularly interesting from your group, particularly a barrier that maybe some folks had in common, or a key next step that you want to take to sort of connect between the housing and justice systems. We'd love to hear what people have been talking about. And while we sort of do that, I'll hand things back to Thomas to wrap us up and share some supplemental resources that can help keep the conversation going.
Thanks, Charlie. And yeah, I can realize it'll take a second for folks to type things in the in chat, but definitely heard a lot of great conversations going on, which is so very heartening to hear about cross-system work that is both ongoing and just starting. Yeah, so on the next slide, we will be sending slides out to everyone who registered, but really certainly wanted to lift up that we'll be sending out worksheets, which can't quite see the picture for this, but that's all right. You will see it soon enough in your email. So we'll be releasing worksheets with each webinar in this series. They are optional, don't have to complete them, but each workshop really will help guide discussion to identify opportunities to collaborate, barriers to overcome, and strengths to build upon. Really the things that you each started to discuss today, but really want to help this be helpful locally. So you can use these worksheets or between sessions really to help plan, help assess what you've got going on locally, and help collaborate locally. So there's space for notes, questions that you started with your partners, maybe even questions to help lead the discussions with your partners in between sessions. And again, we'll be sending them out between each session. And on the next slide, we're very excited to announce that Charlie has authored and released some action points, which is a 4-step guide for policymakers to take on increasing housing options and improving these just key outcomes. And while this is targeted for state leaders, these are also the same 4 steps that we see that they work at the local level a bit differently because things are different from the state down to the local. But in general, still the 4 steps that you can be taking locally to get this work off the ground. And probably you will notice that our webinar series generally follows this this outline because of just how applicable it is across the housing, criminal justice, and behavioral health systems. And on the next slide, also, it's really heartening to see everyone's responses in chat too. So I really appreciate it. Also want to leave you with some of our resources on collaborating between systems, including in reentry with parole and probation, as well as law enforcement and homelessness systems. And on the next slide. Also some examples from the field, because we know that these are always just so very helpful and also so very nice to take back to our communities with examples. And so Charlie has also authored both of these, including showing how folks in Kansas were able to leverage funding from the federal government through the Emergency Solutions Grant Program for rapid rehousing assistance, folks leaving incarceration, as well as how states are engaging private landlords. And again, this touches at what the state can do. But as we talked about today, we know that especially private landlords, this can be such a local conversation, such a local effort to recruit folks to really to join our teams and help open up housing opportunities for the people that we're working with. And on the next slide, we also have a collaborative case planning tool that we think is pretty great. And that we'll be updating within the year, also to include housing, but this can also help get your collaborative efforts off the ground and working together in a really, really concrete way. And so on the next slide, we hope to see you back in the new year, and I'm incredibly sorry for bringing up just how close that is. But we hope to see you on January 27th, same time as we move to discuss assessments and screening. And I see we've got a hand raised. And Jennifer.
Hi. Yes,
Hi.
sorry. Just wondering for the next session, is there a new registration that needs to happen or yes? Okay.
Yes. Yep. So there'll be a new webinar registration link, and we will be sending that out in our follow-up email
Awesome.
to this. So as long as you registered for this one, you'll get the invitation for the next one.
Beautiful.
We'll
Thank you.
Yeah, you're welcome. And we'll be sending out promotional materials also along all of our networks too. So you can feel free to pass those along to friends too. And I believe that wraps us up for the day, right at 1:30. So really glad for all of you to join us today. And if you have any questions, please feel free to contact Charlie at his email address. And I really hope you have a great rest of your day. Thank you each so much. Take care.
Thank you, everyone. Happy holidays.
Thank you. Thanks for joining, everybody.
Thank you. Have a good day.